Can your hip problem be causing low back pain, sciatica pain, or even piriformis syndrome? I'm Dr. Matthew Posa. Welcome to the page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. If you got low back pain and you're suffering with this type of issue, it could turn into sciatica. It's pain down your leg, it's pain into the side, it's pain that's affecting even things like the piriformis. You're not sure what's going on. You've tried a lot of different things. One of the things that is generally overlooked is going to be your hip mobility. What's happening with the hip? And so when you look at the spine and we look at the low back, and so we have your pelvis here, we have all the low back joints, we have the spine and all the nerves that are coming out of the spine, we have the disc, we have a lot of different structures. So I think the biggest thing here is that there's a lot of different reasons why you could be having low back pain and why the nerves are at play. But one of the things that's generally overlooked is going to be what's happening with the actual hip itself. So your hip socket, there's a deep hip socket, your hip fits into that and it's meant to rotate and turn. Well, if that gets stuck in any way, it gets impinged, it's lost its range of motion, well then the muscles that surround that area are going to be working harder. They're going to be pulling on structures and that can throw out your spine. So today what we're going to go through is two very simple stretches that you can do at home that's going to increase your hip mobility. It's going to help protect your hip, loosen the muscles, protect your spine, take pressure off the nerves, and help you get pain relief. The first thing that we're going to work on is going to be your hip mobilization. So in this exercise or stretch, what you want to do is you want to get yourself on the ground. You want to bring your knees shoulder width apart or even wider if you can. And as you bring them wider, you're going to bring your torso out. So you're going to lunge a little bit forward. Now the key here is to protect your back, because especially if you got back pain, we want to protect it. We don't want your spine rounded or too much going the other way. We do want a neutral spine. And so there is a couple positions that you can try. One of them is going to be on your elbows. But if you can't flatten your back and you're noticing that you're rounding or you just can't get to that position, you can definitely do this on your hands. And what you want to do is you want to start with a position where you're bringing your bum down and you're touching or trying to touch your heels. Now, as you do this, you're going to start to feel some of the front of your hip. You're going to start to feel that mobilize in through the front, and you're going to feel that tension. But then what you want to do is you're going to bring yourself forward and you're going to roll one foot out and bring your hip down to the ground. You'll hold that for just a couple seconds. Bring that back, sit back onto the back, on your bum onto your heels, and then you're going to come back forward, and then you're going to rotate the other side out, rotating your hip forward, and then bringing it back. And you're going to repeat that 5 to 10 times. And as you do this, you're going to try and go a little bit deeper every time and get that range of motion built into it. This is not only going to help your low back, but it's going to help all the muscles in the hip and into the side of your leg, create more balance, more mobility, and improve any of the pain that's there. The next stretch that you can do is the 90-90. So with the 90-90, what you're going to do is bring one foot in front and then the other foot is going to be behind. So what you want to do is you're creating 90 degrees on one side, you're creating 90 degrees on the other foot. So you have 90-90. And then the key here is to bring your torso forward. So I'm going to use my hands to bring myself forward and over to the side. And now you're going to be feeling, so in this case, because I'm on my left side, you're going to feel that in the left side. This is going to help with the sciatica, with the hip, and increase that mobility. So again, you're going to bring yourself over, forward, hold that for 5 to 15 seconds. So if you can get to 15, that's where you want to get to. You want to hold that position, and then you can release. You can repeat that one more time and then switch side. Let's say you have pain on the other side or you just want to work on both sides. This is a great stretch that's going to help mobilize your hips. Try those exercises or their stretches at home. See what that's like. Again, this is one of the most overlooked issues that people have. that's regarding the low back, that could be causing the low back pain, that can be causing all the muscles in your low back to be tight, your pelvic muscles, the nerves that are coming out of the low back that are traveling down the leg, causing sciatica, things like piriformis syndrome. I mean, there's so many things that can be linked here, and the job of somebody like me, a chiropractor, is to look at this, to assess the problem and figure out what's going on and the best course of action. So if you don't have a chiropractor, if you're not under regular chiropractic care, make sure that you go to your local chiropractor, get a proper assessment. If you need x-rays or any other type of imaging done, get that done, understand the problem, figure out a best way to solve it, and get under regular chiropractic care. This can not only help solve all the problems in the back and the alignment and those issues, but then you start using some of the things that I'm showing you on my page, and you're gonna notice you're gonna get the results that you're looking for. If you have a comment or question, you can leave it down below. If you haven't been to my page before, this is your first time, welcome. Don't forget to like and subscribe and share this information with people that we know need to hear this. And until next time, we'll talk to you soon.